Bob Morrison. I'm a retired United Methodist pastor. After preaching for about 60 years, I pastored a Methodist church here in town for a number of years and retired in 2000. I'm married to my wife Earlene for 58 years, and we have 3 children and 7 grandchildren. A stroke. The stroke happened on September the 8th. Those days don't you forget. September the 8th, 2013. I woke up in the middle of the night, 2:30, and I couldn't feel my pillow. And woke my wife and told her I couldn't feel my pillow, and she knew exactly what to do. She said, "What's the matter?" And I said, "I have a feeling in my left arm." And she said, "Well, can you say a sentence?" And I tried. I evidently wasn't very successful. And she said, "Can you smile for me?" And I did that, and apparently wasn't very successful either. So we called my son-in-law, Mark Calvert, who just lives 100 yards from us. And he took us to the hospital. He took me to the hospital middle of the night then, in time for the Dr. Makos to get there and administer the clot buster. People look at me and say, "We can't tell you've had a stroke." Dr. Makos said when we got to the hospital, she said, "I don't know what kind of divine intervention woke you up, but had you not awakened when you did, you would have awakened in another land someplace." So that led us to be very grateful for the fact that I do have residual effect, but to look at me, you wouldn't really notice it. I have a numbness in my left side of my face, lips, a numbness in my fingers, and a tingling in my arm up past the elbow, and my left foot. I don't know if you ever had your foot go to sleep and try to put it down on the floor, what it feels like. Every time my left foot hits the floor, it feels like it's hitting on pins and needles. I know I've had this stroke, and I know I'm blessed to even be here, but I also know that people look at me and can't tell I've had a stroke. We have tacked on our medicine drawer, cabinet door, signs and symptoms of a stroke, and she knew exactly what to do. And then once she did that and we knew I was having the stroke immediately, why, it was to the hospital. And so I'd encourage people very definitely to have those stroke symptoms close by, or at least memorize them so you know what happens in case somebody loved one of yours is experiencing those kind of symptoms. And we've known people, in the ministry, I've known lots of people who've had strokes over the years, and so a part of our health care was to try to provide information. So we have a first aid information in that door as well. But one of the things, being our age, we know that strokes are always a possibility. So we wanted to make sure that we were prepared, and so we just had those taped to the back side of the door so we could glance at it immediately. She didn't even have to go down there, though. We live on the 3rd floor of our house. She didn't have to go down to that medicine cabinet because she already knew what to do. The biggest change I've had is the medicine for Plavix. I'm a woodworker, and my hobby is woodworking, and it's very hard to be around splinters and work, and I grow roses. I've got over 20 rose bushes. And it's very hard to go out and work roses without getting pricked by a thorn. And I bleed like crazy just touching anything. And I asked Dr. Makos if I could get off of that. She said, "No way." She said, "Really, your stroke was not caused, the cholesterol was very good. Your carotid arteries are very clear. The only way we can really tell that you might have caused it was 2 blood platelets apparently tried to get through a very narrow passage in one of the veins or arteries and couldn't make it and blocked it up. And so the reason for taking the Plavix is to help those slip on through without getting blocked up. So I don't like the Plavix because I just bleed like anything, but it's necessary, and I'm trying to learn to adjust to it.
My name is Alma Hahn. I work as a shift manager in the emergency department. I'm a mother of 4 children. Been married for 17 years. I was diagnosed with a left cerebral vascular accident on February the 20th. I remember it started about 12:30 after I dropped my oldest son off at preschool, and had a strange sensation of just feeling, my brain feeling tired, and it was just a very vague symptom. And I thought, oh, I work nights, it's the day, even though it's my day off, I'll just go home after I go to the grocery store and take a nap. And got through the grocery store, got my groceries, bagged them up, and then I couldn't get them into the vehicle. So got somebody to help me out, put them in the vehicle, because it's just all of a sudden just weakness. And it's still a little disorienting on how I really felt, because I did the whole face, face looks fine, I'm not drooping, my smile's fine. At the time I could still talk. Didn't understand if it was slurred or not, but I could still talk. And I thought, well, just go to the ER, and just because I didn't feel right. And so on my way, I called my husband and found it hard to try to find the words. And by the time I got to the ER, I couldn't form the words. So they got me back immediately, got me to CT, got me diagnosed, had Dr. Makos in very quickly, and decided that TPA was a wonderful choice, and they administered it, and within the hour I was able to actually talk. Slow, but I could talk. Slurred, but at least I could talk. I'm almost back to completely baseline, which is good. There are a few times when I push my body too hard, I have relapses, but majority of the time I'm back to normal. My speech is clear after having speech therapy. I'm back to work, doing everything that I was doing before. Still some weakness because I'm not back to where I was, but still it doesn't slow me down. It takes a lot of hard work to get back to it, to baseline. But if you have the symptoms, get in fast. The faster you get in, the better your outcome's going to be. The faster we can treat you, the faster we can get the oxygen flowing to that part of the brain. Your outcome is so much better. But it does take a lot of work, a lot of effort. I put a lot of time reading to my kids in order to continue getting my speech better. I have seen patients that had worse symptoms than I ever did, and that I never thought as a provider would get very far, and after a year come back with overcome extreme measures. So, it takes a while. It takes a lot of hard work. It takes a lot of rehab, but it can be done. Other than I've changed my diet. We do unprocessed foods. I've cut down my caffeine intake, and I'm one of the few who, other than my size, my weight, I didn't have any other risks. I just happened to have a fast heart rate at one point that possibly threw a clot at that time. That's the only thing we can account for it. Try to take more days off, majority of the time, and try to stay as stress-free as I can.